Welcome to Overcoming Physician Burnout as Health Architects, a series in which we talk about different ways that physicians can approach their clinical work to make it more rewarding and fulfilling. This is Venkatesh Ramnath. Today is episode 4, How the Foundation of Medical Science Can Help Us Through Burnout. For your information, if you prefer reading, I would invite you to take a look at the written post, which also has embedded links for references that are cited. In previous posts, we saw how making a new oath is necessary and how the health architect's practice model complements it. Now we'll roll up our sleeves and start building the foundation of that practice model as health architects. To restore our lost sense of agency and control, we as health architects must build a scientific attitude based on the foundation of medical science that comprises two concrete principles. The first is an understanding that medical evidence is essential to medical knowledge. Before the 20th century, medicine often felt like gambling. Physicians relied on personal experience and anecdotes, leading to wide variations in care and limited trust in the profession. Treatments rarely worked, and distinguishing credible doctors from quacks was nearly impossible. What was the result? Well, stress and anxiety and uncertainty for physicians and patients alike. The advent of science transformed medicine from impotence to power. By the mid-20th century, rigorous testing, statistical methods, and evidence-based practices gave doctors reliable tools like antibiotics, pain medications, and effective surgical techniques. Evidence became the bedrock of modern medical knowledge, replacing guesswork with predictable outcomes. In other words, scientific evidence set the foundation of medical knowledge since it became way more useful than anecdotal experience alone. As a trainee, I saw this for myself. I was inspired by mentors who wielded evidence-based medicine, EBM, to craft clear, logical clinical arguments. Their mastery of evidence didn't just protect them against doubt, it gave them confidence. They steered past cascades of what-ifs to focus on what was most likely, using tools like Bayes' theorem to weigh the likelihood of different scenarios and make better predictions. For me, this approach was transformative because medical evidence replaced my anxiety with clarity and made uncertainty, which was often unavoidable, actually manageable. Practical tip number 1. Try to lean on evidence without relying on personal anecdotes. Using EBM to bolster your clinical rationale can transform guesswork into predictable outcomes, giving you confidence and reducing your anxiety when making clinical decisions. The second principle of a scientific attitude is understanding the underlying scientific processes, not just the outcomes. Using EBM is not merely applying conclusions as a dogma for all patients without reflection or personalized application. Philosopher Mario Bunge, in his book Medical Philosophy, Conceptual Issues in Medicine, sagely indicates that the primary importance of evidence in medicine is twofold. First, evidence allows us to understand causal mechanisms. Generating evidence involves testing hypotheses to uncover cause-effect relationships, not just correlations. Some examples include the causal link between smoking and lung cancer, lipid levels in cardiovascular disease, Helicobacter pylori and stomach ulcers, human papillomavirus and cervical cancer, and sun exposure and skin cancer, just to name a few. The search for cause-effect relationships is iterative and continual because, as an inductive science, medicine uses insights that are new to replace the old ones. By the way, this perpetual updating does not negate current understanding. The doctrine of fallibilism allows us to rely on what we know today, even if we cannot prove it is going to be 100% true tomorrow, as is always the case in medicine. Second, Bunge describes how evidence allows us to compare different interventions. This includes determining which treatments are most effective under which conditions. Is medication A more, less, or as effective as medication B to cure pneumonia or lung cancer? Remember that many treatments are often studied as non-inferior alternatives to older options, especially when a placebo cannot be used as a control to the experimental intervention. Practical tip number 2. Look beyond the outcomes to understand the underlying process. A deeper understanding of cause and effect can enable you to personalize treatments better and apply evidence thoughtfully. By embracing medical evidence as a foundation and understanding the scientific processes behind it, health architects can transform uncertainty into clarity and restore confidence in clinical decision-making. This is the essential power of medical evidence in medicine, and it is the first pour of cement into the foundation as we actively build a practice model for health architects to overcome burnout. Okay, I hope you enjoyed this post. If you did, please click like. In the next episode, I'll be talking about the importance of reducing the set of unknowns to boost confidence and minimize anxiety during our clinical practice. This will involve discussing how we must move through possibilities and plausibilities to get to probabilities, using evidence to help us. This then will guide us closer to understanding a key attribute of being an effective and balanced physician, the scientific attitude. See you soon.